right, Scott. And in this Give Me Five, I very quickly just wanted to touch on the whole idea of when it comes to taping, otherwise known as securing, an endotracheal tube. Where do we actually document that the tube is secured at? So, first of which is we have just a quick bit of nomenclature. Meaning, for years, we simply said we're going to tape it at X number of centimeters. However, in our most recent version of the PD wheel and the latest version of the new Neo wheel as well. We were blessed to have some seriously smart reviewers who said, you know what, you're putting tape, however, many places, whether it's in the hospital or in the pre hospital setting, are using some sort of a tube holder. And therefore, even though tape is very commonly used, probably a better term we should be using in the future is the tube is secured at X number of centimeters. Now, taking that bit of nomenclature out of the equation, the interesting part was again brought up by a transport nurse and a transport respiratory therapist. And as they were reviewing the latest version of our PD wheel and our Neo wheel, they both had exactly the same insights, which admittedly I had thought of over the years. But honestly, when we were creating this, I forgot. And why this was really important was they said that what's very commonly described in patients is the endotube is secured at X number of centimeters at the lip. The problem they brought up is, especially if you have a burn patient or an icky facial trauma patient, remember the lips are going to swell. And therefore, if the lips are like way out here and you secure the tube way out here, then the swelling goes down. Your tube may or may not be still in the correct spot. So they said, do not list that you taped it or secured it at the lip. So then my brain said, okay, fine, we'll just go for the teeth. And they're like, that's good, except remember the little ones, especially babies, don't yet have teeth. Therefore, you know what? That doesn't work. It also doesn't work really well in adults because depending on where you're at in the country, if you happen to have meth mouth, otherwise known as you have no teeth, well, that means that we shouldn't be going at the lips and you may or may not actually have teeth. So, what that leaves us with, both of us had the same insight. They said, really, what we probably ought to be using in the future is taped or secured at the gum line. And honestly, in retrospect, thinking about this, it's actually brilliant. And the idea being your lips may or may not be swollen, you may or may not have teeth, but chances are you've always got a gum line. So, with that in mind, the idea of securing versus taping and documenting at a consistent landmark, meaning the gum line, whether it's a baby or a big person, is probably something you're going to see much more of in the future.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best: under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next PEDS patient could be your worst PEDS patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.